The health department is concerned about the high level of teenage pregnancy. More than 145 teenage mothers gave birth in public hospitals on Christmas Day, the youngest being a 15-year-old in Limpopo. According to the World Health Organization, South Africa has one of the highest rates of teenage pregnancies in the world, with almost 1 in 4 girls and young women falling pregnant before the age of 20. Joining us now is Deputy Health Minister Dr. Sibongiseni Dhlomo. Very good morning to you, Dr. Dhlomo. Thank you so much for your time. Very concerning as we take stock of the prevalence of teenage pregnancies in South Africa. Again, coming under the spotlight, considering the numbers that came out on Christmas Day. What's your immediate reaction?
Good morning, Mpho Sithole, and good morning to your viewers at home and everywhere. It's just that it so happens that on the Christmas Day, our provincial MECs were all over the country in various hospitals and looking at the Christmas babies, and then they picked this up. But this is a common occurrence. We pick up this information every day. That is why we do have plans, not only because we were alerted by the visits, but it's just that a big number of our MECs were there, therefore picked up these numbers on that one single day. But every day we have teenage pregnancies and we have teenage deliveries in our hospitals. But we do have a plan, depending on who you ask. The Department of Education, Department of Health, we do have statistics because we see them coming to our facilities. But this matter is largely a societal matter that must be addressed, not just because we're on a Christmas Day or New Year's Eve. On the New Year's Day, again, they will bring you new figures regarding this matter.
According to the World Health Organization, South Africa's got the highest rates of teenage pregnancies in the world, with almost 1 in 4 girls and young women falling pregnant before the age of 20. That in itself shows that we have a crisis on our hands. What is your department doing about this?
Yeah. Let me add, before I just give you our program, if you do segregate that data, Mpho Sithole, you'll actually be shocked to say proportionally a large number of those teenage pregnancies are in the black African child, because we have taken a decision that my 15-year-old daughter is really not getting into this space until we agree that as a society we lead and say, by the way, my 16-year-old may actually be pregnant, may be actually sexually active. Let us allow these programs to actually be discussed about even in schools. Let me start by our program. Our program that we have in schools is that we have school health nurses who visit schools, largely primary and secondary schools, and they do some health education, and one is on eye care. The number one is on, the second two is dental care and hygiene. Third one is issues of hearing and making sure we improve quite a number of our children who otherwise would not have actually passed if they were continued sitting at the back of the classroom because we did not come in there. So they get classes, reading classes, because our nurses are in schools. Now, when we want to extend further and say, look, can we, among other things, educate and get some of our nurses to talk about what these young girls are teaching us, to say, are you sexually active? Can we assist you? And the school governing bodies have said, no, this is too early, this is taboo, we can't have such programs in schools. And those are issues that we need to talk about, Mpho Sithole, to say, there's a 15-year-old girl who comes to our clinic and say, Dr. Dhlomo, Nurse Monica, I am sexually active. I don't want to fall pregnant before I finish my matric. What can you do to help me? Now, if they individually come in there and we create programs for them, then we should be able to say, we should take these services back to schools in a large scale. But however, what we have done as a Department of Health, we have created what we call youth zones, where we now know through dialogues with our young people who say, but Dr. Dhlomo, a lot of our nurses are having an attitude, prejudices against me, coming to a clinic asking for help. What can I do? So we created youth zones, a nurse in a clinic who is trained to be youth user friendly, who also has no attitude that is bad to young people, who is not judgmental, and we're going to be assisting them. We have 1,800 of these facilities in the country now. We want to expand and extend that we give such a service to. We want to create a demand for our young people to visit our health facilities to get this health information.
Yeah, Dr. Dhlomo, but the other very, frightening part of these figures, with South Africa being in the world, across the world, in the lead across the world, is the issue of sexual assault, rape incidents occurring, which may be part of the other bigger problem, besides the fact that young people are engaging in sex at a young age. But what about the older people who may be needing to be arrested in this regard, because it shows that rape and sexual abuse could be some of the contributing factors? What plan is in place there when 12-year-olds or a 15-year-old goes into a clinic? Surely the questions should be a lot more intricate than just being told to come back at a different time for checks on the baby and the newborn, and being taught all sorts of things about being a young mother. But the question around learning more about the situation that this young person may have been involved in should be one that also comes to the forefront as we try and get to the bottom of why so many young people are falling pregnant at such a young age.
Yeah, that is one factor, but I'm sure you are bordering on asking, what are we doing about those that are probably statutory rape? Is that what you are trying to say? Because I would actually say we do have a challenge with that. It must be a multi-sectoral discussion. We do take an oath and a nurse's pledge to say, I will keep this confidential discussion between myself and the client or a patient. What we do is to actually say, this 14-year-old pregnant, raped, let us bring the parent in and discuss, because this is statutory rape. And therefore, some responses from parents is that, look, the matter is being sorted out between two families. Let us not take this further. We do not have that as a point that points to us as healthcare workers now to go to the police station and open a case. And maybe we need to be persuaded, though we have our own reasons, that it may just be, it will jeopardize that other Gladys, who also is pregnant, next month, to come to our facilities and report, and we get assisted, because teenage pregnancy is a very risky pregnancy. We actually want to make sure we get all of them, assist them, and make sure we also deal with the very difficult labor, which is very risky, of a teenager. Now, if you were to actually arrest this just first one, the others who are coming in next month will probably not come and be discouraged. So we need to work around this as a society. What do we do with families and parents who say, don't worry about my 15-year-old girl, she's already being a Makoti Lobolad somewhere else, and therefore you need to stay out of this matter. And it is actually a statutory rape. That is one part that I am saying again to you, Mpho Sithole, the society must lead, not just the Department of Health, Department of Education. School governing bodies must give us a guidance. The society, all our leaders must say, let's come together. What is the plan about these things?
Very well. Thank you so much for weighing in on this discussion, Dr. Sibongiseni Dhlomo, who's the Deputy Health Minister, speaking and responding there to the concern on the rate of teenage pregnancies in South Africa.